Thank you, colleagues. My name is Dr. Edwin Maina. I'm the Health and Nutrition Coordinator from Concern Worldwide Kenya, and I will be presenting the work that we have done on empowering mothers and caretakers to screen children under 5 for malnutrition using what we call the Family MUAC. MUAC stands for Mid-Upper Arm Circumference in Kenya, and I'll be presenting on behalf of myself and my colleagues, Kate Golden, from Concern Worldwide, and Weldon Getich from the World Food Program. And it's a pleasure to be invited to present this at the Irish Global Health Network Conference, which is focusing really on global imbalance and social inclusion. By way of background, I must say wasting continues to threaten the lives of about 45 million children under the age of 5 globally, and 12.1 of those children are in Africa. And out of those 12.1, 4.3 million are severely wasted. In Kenya, where we implemented the project, 4% of the children under 5 or more than 500,000 children are reportedly wasted. In the arid and semi-arid lands of northern Kenya, we have the highest burden wasting. Some of the counties and sub-counties, we have wasting as high as 30 to 35%, what global acute malnutrition rate. These areas suffer from long-term effects of recurring drought and related food and nutrition emergencies. The prevalence of acute malnutrition, for example, in North or sub-counties where we implemented this, was more than 20%, and this is to the last 6 smart surveys that have been undertaken. One of the major obstacles to early detection and treatment of acute malnutrition or wasting is that caretakers of young children often do not know their children are malnourished and would be admitted for treatment if they were brought to a health facility. And so as a result of that and responding to that particular context, Concern Worldwide and Trinity College, with funding from Innocent Foundation, implemented a 2-year research project for a low-cost, high-impact nutrition intervention, and we were asking ourselves, does the mother's use of the MUAC screening improve early detection, referral, and prevention of malnutrition among children under 5, with specific references to the challenges faced by the pastoralist communities that I've talked about? We targeted about 849 children, 420 moms, and about 40 community health volunteers. And of course, what is Family MUAC? Family MUAC, or what we say the Family Mid-Upper Arm Circumference, is an approach that supports caretakers, including moms of children under 5, to regularly screen their own children for acute malnutrition using the MUAC tape. The MUAC tape is the figure that is on the right side, and this is rather than waiting for community health volunteers to come and do the screening. So the mothers are trained to take and interpret the MUAC or mid-upper arm circumference or by themselves and bring the child to the health facility if they find that their child is severely wasted. Should be around that area of red, or moderately wasted, and this would be around yellow. If the MUAC was falling in green, then those children were fine. With these skills, mothers can catch malnutrition early and be confident that they can make the often long journey to a health facility and that it will be worth the journey. So how was the approach? We identified sites in North Sub-County, Marsabit, in Nairobi, in Kenya, and we were able to identify specific wards who were randomly allocated to control and intervention groups. And the purpose was to ensure that Family MUAC could be tested in an area with a control group to demonstrate any improvement in the management of children with malnutrition, as well as the knowledge on good practices. We undertook baselines, assessments, and after that, we trained mothers on how to use the MUAC tape and to regularly screen their children for malnutrition. We undertook periodic assessments, which provided critical information on how to implement the project, and then after that, we're able to undertake an end line. So on your right, this is a picture of a young child in Marsabit, somewhere in Marsabit, whose mid-upper arm circumference is being taken by a health worker. So the key result from a behavior change perspective, we are able to assess factors that are likely to influence the MUAC screening and the referral behavior of children in the intervention arm. And we used an assessment tool that was based on the COM-B model for behavior change, which was able to suggest the capability to adopt a behavior, the opportunity to apply the behavior, and the motivation of being able to undertake the behavior, with all the three factors being capable of changing behavior. We asked mothers to express the level of agreement to determine their capability. We also asked them to determine how they could use the opportunity to screen their mothers, and how they were motivated to screen their mothers. And overall, mothers were able to report that mothers who reported having screened their child during the first week prior to the survey interview had significantly higher capability, opportunity, and motivation scores, as you can see from the graph on the right, at a number of points compared to those who said that they were not able to screen their children. The other key results from the project is that we were able to note that there was an incremental improvement in the proportion of mothers who screened their children on a monthly basis, and this improved from 63% to 79% by the end of the project. We also noted that mothers accurately screened their children for malnutrition, and we compared the screening with that of the health workers despite the high illiteracy levels. And the reason for this is that we trained the mothers, focusing on them interpreting the readings based on the colors and not the actual number of readings. Furthermore, during the periodic assessments, we are able to determine that there was an agreement between the mother screening and those of experienced nutritionists, and those were the gold standards on this particular project. Moreover, mothers or carers were empowered to take appropriate action on screening their children. We noted there was an increase in the proportion of mothers who took appropriate actions after screening their children, and this improved from 61.5% at baseline to 75%. Appropriate action means they either refer the child if the child is moderately malnourished or severely acute malnourished, or they were able to improve the feeding if the children were at risk. We also noted that the mothers were able to refer their children early for management. And the earlier you're able to refer a child for treatment, the better the treatment outcome. And further, we are able to note and realize that the mother's knowledge on child feeding practices improved significantly. For example, a knowledge on breastfeeding improved from as low as 44% to 92.4% by the end of the project. And in conclusion, we note that the Family MUAC approach has empowered mothers to detect malnutrition early and to take action, including taking these children for treatment. And that is critical, and that has reduced the death or morbidity and mortality as a result of malnutrition. Moreover, Family MUAC reduced the workload of community health volunteers who would be primarily tasked with screening and referring children for treatment. We note that Family MUAC was also adopted as a critical approach to ensure continuity in the screening of children during COVID-19, especially at a time when all community level engagements, including household visits, had been prohibited as a measure to reduce the spread of COVID-19. The next steps that we are going to take is that we are going to, and we are advocating for the resourcing and the scale up of the approach nationally and suitable context. Actually, as we speak, Family MUAC has been adopted in Kenya and has been rolled out in several other counties. And it is one of the critical approaches that enables mothers to detect malnutrition early, and they're empowered with the information to even negotiate with their spouses or their partners when seeking services from the health facility. And of course, we have quite a number of resources that one can refer to on Family MUAC. For example, we have the Simplified Approaches website, and the Simplified Approach is, as a concept, includes several other simple approaches in reducing morbidity and mortality from malnutrition. And we have, of course, a number of sites, including the Family MUAC page and the State of Acute Malnutrition website. And then we have a number of publications that we have been able to present as concerned worldwide, including in the CMAM 2021 conference, which was hosted by Concern Worldwide and Irish Aid in March 21. Feel free to reach out to me on the email provided below. Thank you so much for your attention, and over to you.